How about that?
Yep, Angie, I mean, you can call the meeting to order and take roll.
All right, Pat, I'm going to have you kind of guide me through this because I can't see anything other
Okay.
than I have the agenda in front of me. Is that okay?
Yeah, that's fine.
Okay. Today is the 5th of January of 2021. That is the first, it's the first meeting that we have had in a long time for the River Bluff Nursing Facility. And we have invited other people to be on this besides just some staff and our administrator, Pat Thompson, who just started the meeting. We call it to order. The time right now is like 7 minutes after, 7 minutes after 2. And let's get going with the roll call. First of all, you just heard from Sue. Sue Schroeder is with Stepping Stone. I'm going to introduce the advisory committee before we start because none of you really know who's on the advisory committee. And this year we've done a little change on it too. She's the CEO over at Stepping Stones, and she's been on our committee now for a couple of years and has been a real asset to us. The other one, Shelley Harkness, are you there? Shelley Harkness is a nurse who's on our committee. Right now she's down in Florida, so I hope she didn't have problems. Apparently she's had problems getting on Zoom. She knows all about Zoom and was planning on being here today. If she is on, perhaps she needs to unmute herself so that we can hear her. But Shelley has been with us for quite a few years, and it's always nice to have a nurse who was nursing for probably 40 years, 30 to 40 years, and has been all through the different processes, even training with nursing. Our next person is Patty Bigger. Are you there, Patty?
I am.
Patty is from, people don't realize that we do have an auxiliary at River Bluff. And the auxiliary does a lot of different planning programs throughout the year. But of course, this year there hasn't been any planning of programs. And I thought it's time that we had someone on our advisory committee that could represent the residents. Those residents are very important. We used to years ago. We used to do a survey through the residents and to find out their feelings and all. This way, we are hoping that Patty will bring back to us some of the whatever that we have. You know, we don't understand residents have little problems, but we want to know if residents are having any big problems that Patty can bring back to us. The other person is Dave Fiducia. David is no longer on the county board. But last year and the year before, we had started a lot of different things. And I've asked David to come back just as a member of the public. And that way we can finish up some of the things that we have started. And I'm Angie Gorel, and I'm a Winnebago County board member. Also with us today, Pat McDermott, who do you have with you?
Okay, so I will do the best to see the pictures as I go along. I have Tammy Boyce. We've had quite a change in nursing administration. And we have quite a few nurses out, administrative nurses, so everybody's wearing a few hats right now. Tammy has been here for a long time. She started out as a CNA here. She has been working in restorative. She is most likely going to be one of our unit managers. Right now, she's also helping us out with our infection prevention as far as our COVID goes. So she's a busy girl.
And who else do you have with you?
And then I have Laura Schaefer. Now, Laura is a new staff member here. Her intended job is to do quality, be the quality nurse. she too, unfortunately, has gotten thrown into COVID because it takes a village with this stuff. So she's really just started, what, a couple months ago, Laura? And she's been a great help. She fits in great. Once we can really get her over to doing doing the quality work, that's going to help us out a lot. And we did, by the way, go from our 1-star to our 2 stars. So she's going to be working on our 3rd star. Then we have Dan Ortega. He was the unit coordinator for the Dove unit. He has accepted the ADON position. So he's been doing that interim, and now he's officially has a position. So we can see already he's going to do a great job for us.
Would you tell his initials are? You
Dan
said he's
Ortega.
Yes.
Dan, are you
Don't-
there?
Don't do the acronym. Tell them what he does.
I'm right here.
Oh, I'm sorry. He's Assistant Director of Nurses.
That's what I want. He's Assistant Director of Nurses. Dan, congratulations on your advancement. You did a great job down in the Dove unit, and I'm so pleased to see you've come forward. Thank you. And who else do you have with you?
Okay, then there's Carol Whitney. I think you know her. I don't know if everybody else downtown knows her.
No,
Carol,
they don't know Carol, and we want them all to know who Carol Whitney is.
yes, Carol Whitney is a gift from God. Carol does our HR and just about anything else she's asked to do. She really does a little bit of everything. She deals with a lot of staff complaints, a lot of staff concerns, and she works herself to the nth degree trying to get a staff in here. So she spends a lot of time on that.
Anyone else with you?
Well, I have to scroll through pictures and see who's here. We have Shelley Hutchinson. Now she is our Eagle unit coordinator. She is on medical leave right now, but she's joined us for this meeting. And that is what I can see from my pictures. Who else of
I'm here.
there we go. Hey, Laura Deweese. Laura is our new marketing hospital liaison person. We've already seen a pickup in our census since she has been here. She believes in a 15-minute turnaround as far as getting residents, saying okay to a hospital and accepting a resident. She's able to do a basic evaluation if the person's appropriate, and then she takes it to the director of nurses, and then we get moving on it. Unfortunately, what holds us up a lot is all the different insurances right now. And let's see who else is here. Anybody else from River Bluff that I'm not seeing? I'm sorry, Lindsay?
Yeah, I'm here.
Okay, Lindsay is Gustafson. I asked Lindsay to be here. She's our activity director. Lindsay has had a rough year, needless to say, because we can't do activity in groups. She has put up more Christmas trees and wrapped more presents, and she was very much involved in our Brilliance on the Buff, trying to make the best Christmas we could for our residents, and she's done a wonderful job. So I wanted her here to tell you guys a little bit about how that went. And
Very good.
Anybody else River Bluffs that I can't see? Okay, it looks like that's all of us.
Okay, and I said that we had our administrator, Patrick Thompson, and then you as the administrator of River Bluff. Do we have our chairman on board with us today?
Yes, we did. He was here.
Is Chairman Ciccarelli still online?
Yes, Angie, I'm here.
Thank you. So that everyone could meet you also, because at this time, you're brand new and no one really knows who you are, and so we want to make sure that you are also heard of on this today. And so then let's follow up. Let's go on to well, I guess we kind of covered. No, you do the update on COVID, because we've had a lot of questions on that. And I know with Patty Bigger, the auxiliary's been wondering what's been going on, how you've been handling it. So let's go into the COVID right now and get an update on what's happening with our residents and with our staff, please.
Okay, well, I can start with that, and then any of my staff that want to jump in, feel free. We've had a total of 52 residents that have been positive and a total of 53 staff that have been positive. All the residents were mostly in July. We haven't had a positive resident now since the beginning of September. We do continue to have positive staff members. The residents are being tested once a week. The staff are being tested twice a week since they're the people out in the community. So that adds a lot of things that we need to do. We're hoping that we've got to get to the point. Since the state is at a standstill until we get to the appropriate level of county positivity and hospitalization and hold it for at least 2 weeks, we're going to be staying where we are right now, which is pretty much complete lockdown. We can't have, we can only have people in for, if somebody's passing away, we'll let the family in. If it's an extreme situation where a resident won't eat, where it's really harming the resident, we'll do, and again, these are, maybe an hour at a time, kind of restricted visits, and then we'll throw them on our testing plan too. So we're pretty much, right now, we're not even allowed to have residents we're not allowed to have residents in common areas at all. On the previous tier, we were allowed to at least have 10 or under residents, including staff, in a group. Now we're not allowed to do that. We do honestly at times, during meal times, space people out and just for us to monitor them, because we don't have a staff to monitor every single person. And if they're a choking risk, it's dangerous to leave them alone in their room. So we got to kind of make a decision on that one. But the residents, unfortunately, have not been able to do too much socializing other than what Lindsay's able to provide for them. So we are planning on September 1 to have our September 1 and 2, we're going to have our first vaccine clinics. And then, I'm sorry, wrong month.
Okay.
On January 11 and 12, I'm sorry, I was thinking about February. January 11 and 12, we'll have our first vaccine clinics. We've just been getting everybody registered and consents, et cetera, for that. And then we'll have a file update the beginning of February, and then about 3 weeks into February. So we should be having 3 clinics. We're doing it through CVS. So they will come out and administer the vaccine. We kind of do all the behind the scenes work, and then they will actually come out and administer it. And that's kind of where we are with it. We're doing a lot of extra monitoring of residents, a lot of extra monitoring of staff. And we're just kind of holding our breaths that, the vaccine gets here and we get through this thing without any more outbreaks. You'll hear that we're in outbreak because the definition of an outbreak is one person that's positive. So at any given time, you probably have a staff member that has been positive within the last 10 days. We have to put staff off of duty between 10 and 24 days, depending upon the situations. So that's also causing us more shortages. And then we've just been doing a lot of education on cleaning, on proper use of PPE, a lot of auditing of that. The state has required us to do some in-depth training that the staff have to take remotely, all of our staff. So we have 50% of that done, which is what was required by the end of December, and then we have the other 50% go in the month of February. And that's a minimum of 3.5 hours of training. So there's just a lot of moving parts that we have to kind of stay on top of, but we're doing well. We just have to keep doing well until we get to this vaccine, and hopefully it's going to work and things will start getting back to normal.
We're all praying for that, believe me.
We are
And I know-
too,
How hard is this on our residents?
very.
How many residents do we have right now?
I think today we're 145.
Pat, this is Pat. Are we admitting patients that test positive?
We have.
Okay.
We've mostly admitted people that have been through their 10-day quarantine.
Okay.
But there were 2 patients that ended up not being through, or one patient that came in that was negative, according to the hospital. When they got here and we tested them, they were positive. And then another resident that we were told they were through their 10-day quarantine, but they really weren't. So we had to put them on quarantine.
Okay.
And so
And do you have
we are accepting though.
Yeah. Thanks.
When they come in, are you putting them into any quarantine at all?
Yeah, right now we're using the entire Blue Jay unit. So the unit we were getting ready for rehab, we were very, very lucky to have it. It's all private rooms. So anybody coming in from the hospital, et cetera, goes down to the Blue Jay unit. There are some exceptions. If they've been through their quarantine in the hospital, we can put them in a separate section of the neighborhood they're eventually going to go to. But most of them do go to the Blue Jay unit. That is also tough on them because they're pretty much coming in and getting put in a room, and we go to them. They're not having a lot of activity or a lot of socialization other than what social services and activities and just our staff can provide for them. But I think that's probably the number one complaint from any of our residents, as you know, they just want to see their families again.
Pat, have we admitted many from out of county? I know our board authorized us to do that a couple months ago. Do you know if we admitted any?
We've admitted a handful.
Okay.
Part of the problem has been, I mean, traditionally before Thanksgiving and Christmas or so, not many people put people in nursing homes.
Right.
It's just not the time unless it's absolutely necessary. Putting people in a nursing home where you know you're not going to be able to see them or even see the nursing home is kind of rougher. Since the beginning of January now, that's picking up quite a bit.
Okay.
You know, where Laura, maybe you can speak to that a little bit more. We're getting quite a bit more inquiries. And, you know, we're jumping on them quickly. Of course, our staffing is always kind of our issue because we have to have enough staff to take care of them. Laura, do you want to speak to the people coming in?
Sure. The admissions were up in December. So were your referrals were up in December. So hopefully, you know, everybody's getting used to COVID, what we have to do during COVID. So I'm hoping that moves along a lot smoother.
Okay.
We had a lot of inquiries too. Now, not a lot of people have made the move yet, but there's a lot of people at least talking to us in December. But we're taking in, well, how many did we take in last week? At least 3 or so, right?
In December, we had 44 referrals. We admitted 18. So we were up quite a bit.
But we have to balance that against people, we lose from death or, and we're getting a little bit more short-term people that are coming in and then discharging back home. But that's a good thing because that's Medicare, so we're getting a higher reimbursement for those people. It's a little bit more work, but it's much higher reimbursement.
Do very many of the short-term turn into long-term?
Is an experience I've seen that they have, but it depends on what kind of short-term we're getting. I mean, we want it to be where we're someplace, you can come for short-term and then go back home. We're not really known for that. That's what we got to push where we're known for coming in short-term. In the past, I would say quite a lot of the short-term end up staying long-term. Because it'll be a situation where somebody falls at home one too many times, they hurt themselves, they go to the hospital, they come here for short-term, but then the family decides to keep them here long-term because they really can't go back home alone. But we're seeing a little bit more of, people coming in, getting rehabbed, and then leaving again.
So the rehab part is where we also want to do more public awareness that we have that type of facility available too, do we not?
Correct, yes. And we do have a wonderful rehab department, and we have good space for it.
Is that going to bother any of your nursing staff, that we would have to increase nursing staff to do that, or are they pretty well on their own, even though they're with rehab?
I would say if anything, you need more nursing staff, because you're talking about people with broken hips, various orthopedic issues that aren't able to necessarily move around very well by themselves, or people that are quite ill after an extreme illness, and just need more time to recoup. The other issue with that is you have a lot more documentation when you are taking a Medicare resident. I mean, the documentation is quite extensive compared to our normal documentation, which is extensive too.
How are we coming along with the documentation? Are we doing better with that?
We still don't have our electronic medical records, which hurts us a lot.
And
pardon?
What is holding that up?
That was, remember, we had gotten approval to use Wells Sky, and then Gus had found out that they were going to be merged with another company, so they weren't going to be around. So we were kind of back to stage one. I know Gus is working on it to some extent. We're looking to just change over to point-click care completely. It's expensive. It's a lot more expensive than the other company, but it would save us so much time. And, where we have to write something in 3 different places, we could write something once. So we're kind of doing it a very old-fashioned way. We were very hopeful that the Wells Sky would have went through, but it just didn't go through.
Is that holding us back from getting, what do I want to say, more money into our River Bluff? Is it taking longer for us to recoup our money?
It's taken a lot more staff time, and it's letting you make a lot more mistakes. If you have to document something 3 times instead of 1 time, you're gonna, there's more of a chance for a mistake to be made. And it's a requirement anyway.
Yeah.
As of the end of October, it was a requirement to be all electronic medical records. So at some point, that's going to come up too.
It's something, Angie, this is Pat, it's something that we have to move on. And I think Gus is ready to move forward with this. We have to make sure that we have the budget capacity to move into electronic medical records. But it's something, like Pat just said, it's something we have to do. And it becomes a liability issue without this.
And
We have been working on this for some time. This is way past due. And I know part of it was because of the finances. We didn't have the monies for it. But this is something that's going to cost us a lot of money if we don't get it straightened out before too long. We're going to be losing so much money on this, we're never going to recoup. And then if we don't do it by the time we're supposed to, the next thing you know, we're going to be getting fined if we don't update this the way we should to electronic records. This has been going on too long. We have to come up with a faster solution to how we're going to get this done faster. And I really would appreciate that Gus and perhaps you, Patrick, and our new officer of finance get together and find out what we can do to get this moving faster. Is there any type of grants out there that we could apply for that would help us get this done faster, since we are a county nursing home and not a private one?
I'm not aware of any, Angie, but it's something that we can explore.
I would appreciate it, because this has been a thorn in our side for a long time. This isn't new. And so it's time that the solution comes now and not later. And really would appreciate it, Patrick, if of what you can do on it, and that way we can get things moving faster.
Okay.
It also is Mark. Are you on there, Mark Lofgren? He may not have been able to get on. It's also going to help us significantly on the financial end of it, on the collections end of it. Again, we're working with the system where you've got to go into at least 3 different areas instead of just using point click here and doing everything from that.
We are working on a very inadequate system that's been going on for a long period of time. And over the past several years, it truly has caused us a lot of financial problems. And that's why if we can, it's been bleeding us, to be honest with you. And we need to stop the bleeding and get this thing done as soon as we can. Would appreciate that. Thank you. What would you like to go on to next? Did we talk about our new nursing administration?
Yeah, I think just introducing everybody. Candy Manning is back, but she's ill today, unfortunately. So she is not here. So we kind of did talk about our first 3 items. I guess rebranding would be our next. And
okay.
About the new marketing program and hospital liaison. The rebranding, I think, is what we might want to talk about next.
First of all, did Dave want to say anything with his new position of how we can help him improve it?
Are you talking about which Dave? Angie?
I'm talking about our the one that's the nurse Dave.
Oh,
Dan.
Dan, I'm sorry, Dan.
No, I'm okay. I'm just listening in. I think Pat is covering it pretty well. We have a lot of work ahead of us, a lot of deadlines, and a lot of challenges. So, I mean, just to stay focused on what we have on our table right now is the priority.
Okay, because I do like to hear from you and from our was it Sandy? I like to hear from both of you of what's happening and what's going on. And that way we can go further into what we need to have done and what we can afford and how we can help you. Thank you.
I think a topic that we beat to death every meeting is just the CNA wages. But you know, it's something worth talking about every time we meet. Right now, what the competition is that a lot of places are providing the COVID hazard pay, and we are not. So on top of not paying what the other agencies are paying, now they have the COVID pay on top of that. So there's a lot of how do you say it? Competition out there for CNA work.
Dan, how much extra is the hazard pay that others are paying? Do you know?
I know my mom works at Walter Lawson's Children's Home, and she is telling me that they get $5 extra for the hazard COVID pay.
Per hour
Is that-
or per shift
Per
or
hour.
per hour?
Yes.
Angie, this is Pat Thompson, just so you're aware and the advisory committee is aware that we are bringing forward a resolution to the finance committee this week. And if they pass this, it'll move on to the county board at our next meeting that would authorize the increase in wages of the CNA by $2 an hour.
Very good, because aren't we also going to be having to increase their wages also? Isn't that federal right now or state that we have to up that minimum wage?
Well, the minimum wage, yes, was increased January 1. And
Yes.
the contract, the CNA contract on January 1 went from $13.15 to $13.51. That was by contract January 1. And then if this resolution is approved by the finance committee, it would increase by another $2 an hour over and above the $13.51. So we would be increasing the wages from $13.51 to $15.51.
Okay.
Which
That'll
I
bring us-
think, based on discussions with our HR director and Pat and her staff, we think that this, if we do this, it would put us right in the ballpark where we need to be.
Very good. That's excellent, because we've always been a little bit behind the 8 ball on this.
Right.
And we really want, and we have such we're probably the only place that also offers CNAs an opportunity to have some financing if they want to go on into a nursing degree. And I don't think private nursing homes do that. And I think we're the only one that does it. Are we not, Pat McDermott?
Yeah. I mean, there's buildings that offer tuition reimbursement, but usually to a lower, what we would offer would be higher, where you could actually get pushed all the way through to your nursing degree.
Yeah, and that's something we need to, when we get into rebranding of things that we need to talk about. Okay, anything else on the COVID or any of this other stuff? We'll go on into rebranding, and who wants to take that one?
I think Patrick did great at it at the board meeting.
Well,
Okay, Pat.
Pat, you can speak to this as well, but I mean, I think over the past couple months, we've engaged with a marketing firm in town to help us update some of our marketing materials. I think they've been great working with Pat. I'm not involved directly, but I see all the work that's being done back and forth. And I think we've really, in addition to this marketing firm that's assisting us, I think Pat's also added staff, and I'm not sure which person it is, Pat, that is working closely with the hospitals in terms of the hospital liaison.
Yeah, that's
So I,
Laura.
yep. And I think this whole initiative regarding the Brilliance on the Bluff for the Christmas holiday season was a kind of a direct result of the work that's being done on the rebranding. And at some point, I think we should talk about renaming the facility and the process that we would have to undergo to do that. We don't want to lose sight of our skilled nursing care, which is a big part of our facility, but we also want to emphasize the rehabilitation component. And I think we already talked about that a little bit today. And, you know, we've tossed around some ideas, River Bluff Health and Rehabilitation Center. And, you know, there's probably lots of ideas. Maybe, you know, we open it up to staff and for their suggestions on renaming the facility. But I want to make sure that ultimately it's the county board that is the final say on the name of the facility once we come up with some ideas.
Laura, yeah, I do agree. This marketing company has been wonderful to have a marketing company to work with. We've already got our, you know, and Laura Deweese is the one that's working with them mostly. But we've already got our, you know, Facebook page up and running, and where she's submitting pictures practically every day. And our website is up and running. And, they're working at, and again, I don't know that much about this stuff, but, they're working it so that it pushes people towards our website.
Mhm.
You know, um, there's a lot they're kind of doing behind the scenes that are very helpful to us. I mean, we've not had a marketing person here or a marketing company to work with, and they've been wonderful. I mean, any chance she has for us to get a little publicity or to do something positive for the facility, the marketing company is helping, and then Laura's jumping in and pushing it through on this end. And we're just looking now at, once we decide what our name's going to be. And I do agree 100% we have to get rid of nursing home. Where we're going to roll it out from there. How far are we going to go with it? Are we just going to change the name, or are we going to look at redoing our brochures and, kind of updating the whole ball of wax? Or are we just going to do more of a soft start with the name, the advertising, etc.? So that's kind of a decision. Laura told me, and Laura, you can jump in on this if you want. She'd worked at another facility for quite some time, and then also for a hospice company. And I think it's wonderful, the people that have known this building through the years and are dedicated and loyal to it, because it was the almshouse and it was the hospital, and you got that sect of people that are loyal, and that's good. That's what's keeping us, keeping things going. But you've got the other sect of society now that figures, oh no, it's a county home. I don't want to go to the county home. We're not doing anything differently than any other home that accepts public aid. We're doing it better, in fact. So we've got to appeal to the people a little bit away from it being the county home, because it's not, there's nothing different. If you apply for public aid, if it's a building that accepts public aid and somebody applies for it, it's exactly the same. And nobody here is treated differently if they're private pay or they're public aid. So we got to kind of use that.
The public doesn't understand either that when your insurance runs out and Medicare runs out, then you automatically go on public aid. And there isn't is there anybody in town that's doing public aid at all?
Laura, can you speak to that?
You know what, it's little to none. They're doing public aid as long as they're public aid already. The advantage that River Bluff has is you guys are doing public aid pending, which is very unique. A lot of places are not doing that. So, like Pat says, I think it's getting it out there. It's getting the word out there that we are accepting, that we are helping people. But as I've been out, you know, it is the hospitals, assisted livings and stuff do still have that, where the poor farm, where the county farm, where the county home. So I think it's the rebranding, the returning everything around and making people think differently than what they are.
Dan, can you come in here for a minute, talk for just a minute?
Sure.
The unit you were just coming off of,
Yes.
what would you name that that unit, and how would you advertise that unit?
I think we already do that at River Bluff. Instead of using the word unit, you would want to use words that sound less institutionalized, like neighborhood. So instead of going to the Dove unit, you would be going to the Dove neighborhood.
But how would we advertise for the residents that are in that wing?
You know, before COVID happened, I would say it would be a lot easier to advertise for a dementia unit or neighborhood. Oh, 1 second. Now it becomes a little more challenging because the restrictions we have, like I don't want to use words like isolation, but you know, the social distancing, it's just not as fun as it used to be. But we still try to have fun. We still try to play music for the residents. There's a lot of interaction going on, so I would focus on the interaction that the staff have with the individual residents.
Okay.
And the relationships they build with those residents.
All right. And then later on, when the COVID's over and we go back to what we think is going to be normal, would you then promote that as a dementia unit?
Yes, it's going to be one big party again.
That was actually a unit that stayed pretty full all the time.
Yeah.
They had a good reputation, and it really stayed pretty full all the time.
Yeah, with the Alzheimer's dementia unit, you know, you have to keep them busy. You have to have activities. You have to keep them stimulated. You have to keep them moving. So it's a hustle and bustle. The staff has more training. I'm not saying that they're any more qualified than the other staff that we have here, but they do have more training in dealing with dementia and Alzheimer's. And I would focus on that too, that the staff is prepared to take in those type of residents.
Oh, now that might be a better way of doing it. Did you ever get certified for that unit, or do we still need to get that unit certified?
The unit is not certified. The staff that we have, though, is. So there is certain criteria that you need to meet to be an official Alzheimer's or memory care unit. We have not revisited that since COVID, but that was something that we were headed for it before COVID.
We need not to take that off our list.
I agree.
Would you continue to work with that and keep that on the table, and keep reminding us of that? As I watch some of these commercials on television, we're just as good as they are, and we need to be certified for that. And that way, there's no, well, you're not certified, or no, you know, some doctor's going to come up with some reason. But you keep that on the table, would you, Dan? I appreciate that.
Part of my accepting the assistant director position was that I would continue educating on Alzheimer's and dementia. And me and Pat talked about that when we sat down. Tammy Boyce is going to be training for that position. So I would hope, and Tammy worked on and started on the Dove unit. So she has a lot to bring to the table. And I have a lot of confidence in her.
Okay. Sounds good. Let's keep going forward with that.
And we
have a lot of baby boomers that are going to be looking for a house to live in because their kids aren't going to take care of them.
I'll
So
see
we
you
wanna-
down there, Angie.
We want to be prepared for it. I mean, we have to be proactive on some of these things. And I know this is going, this is being streamed and all that, but it's reality. And we have to, not only do we have to look at today, but we have to be proactive of what's coming towards us in the next couple of years and get prepared for that so that we can continue going on and being financially secure. All right, let's see, what else is there now? I forgot. I'm off track. Anything else you two would like to bring forward with this?
No, I think number one, we have to decide, and maybe that's a way to do it, take some, just kind of get a plan together as far as what our name's gonna be. How far we're gonna take this. Again, is it gonna be a soft, let's take all our marketing things we have now and change the name, change them up a little bit and go from there? Or is it gonna be a much bigger rebrand?
Okay.
I'm kind of the opinion, and Laura, again, you might jump in on this because you have more experience with it. Start out so we can get it started kind of soft while we're working on more of a long-term one. But number one, get the name changed and get the, documentation to back that.
I agree, Pat, 100%.
Okay. We do have a county board member who's very familiar with all this too. It's kind of been her past and her living. If you ever think you want to pass things by someone else, she might be available for you.
Okay.
Just something to think about.
Okay.
So we've hit on the marketing plan, hospital liaison, and we've kind of done the brilliance on the Bluff. Is there any other matters we need to discuss?
This is Sue. Tell me what Brilliance on the Bluff was. I've been waiting this entire meeting for info.
Then let's get to it. What's brilliance on?
Let me have Lindsay tell you about it. You there, Lindsay?
Here, can you guys hear me okay?
Yeah.
Yep.
Well, hi guys. Yes, I am Lindsay. I am the activity director here at River Bluff Nursing Home.
Turn your camera on, Lindsay.
I don't know if it'll let me.
Okay. That's okay. Go ahead.
It's like me being incognito. It's like you guys can't see, but right now I'm shaking my hands all over the place. But when it came to, bedazzling the Bluff, Pat stepped out on an awesome ledge for me and was able to round up a lot of community, a lot of family, a lot of staff, and the amazing return that we got was, it was insane. It was awesome. It was, I can't explain how much it meant not only to the residents, to us as a facility, but, also to the families, I can't tell you how many hours we were putting stuff up. I couldn't tell you that, but, by the end of it, it was an amazing thing that I was able to play a small piece in a big part of that season. I don't get to do that every time, and to be a part of that was just a blessing, not only for me but for my staff, and to see the looks on the residents and families, even when I would talk to them and I would get cards, and it just it really hit close to home, and I can't repay that enough at all.
Tell us what you did. Tell us what you did to make them happy.
Oh gosh, we decorated, between the outside, the inside, their doors, their rooms, the hallways. We were able to, I know like the auxiliary usually gives us like resident gifts every year, and we were able to adapt more to that and give more to the residents. We did our giving tree this year, which is the first time I've ever done it here. Back at my old building, that's something that I did all the time at Christmas. So to do it here for the first time was it was cool. Just to do that for our residents just made it a lot more happier this year for them, I think.
The building was basically decorated from stem to stern. We had a lot of, we put out a call to the community. It ended up being on TV, and just the, people would send, 40 poinsettias, and they would send a pallet of lights, and they would send, all kinds of gifts, and then, and take names off the tree. So we had everything that the auxiliary normally gives, and a couple charities already give. And then we were able to go out and, times 3 the presents the residents got. They didn't get, again, when you're dealing with, so many residents, it doesn't go that far. Money doesn't go that far. But this year we had so many donations that everybody got, a nice bag of presents, and they got nicer. We've got tables stacked in the basement of just things that still need to be labeled. Just brand new. What?
Got her camera working.
Here now.
There she is.
Sorry.
Her office used to be just presents from
Ceiling before.
Yeah, she could barely get in there. But we just got a huge amount of gifts and donations, and just made it as nice as we could for the residents. That we couldn't do any of our normal stuff, but we definitely, my mask on, they got to open up, and plus whatever their families may have given them. I mean, it wasn't a little token of a donation. I mean, they got nice presents, and we made sure they got things they wanted, and I know I interviewed some residents, and, at first they, especially the men, well, I don't need anything. I don't want anything. By the time I'm walking out of there, I got a list this long of stuff they want, and like the auxiliary, provided decorations for other residents' room in addition to presents. And people were just constantly dropping things off, right up until Christmas.
Even after Christmas.
And even after Christmas, yeah. And Lindsay needs to give herself credit, because she ran for days and hours and hours and days and more hours, getting things in place, and just making it absolutely is not, the residents got extra treats that they wouldn't normally get, food wise, just whatever we could do to make it as nice as we could. And people really responded to it. They really responded to it. So I feel at least good that we did the best we could for them. It's not the same as bringing your family, your family being able to come in and stuff, but at least you got some fun stuff to open up on Christmas. And you couldn't look 2 inches in this building without it having Christmas on it. So where we're going to put all this stuff, I don't know.
Well, that's fantastic. Good job, and thanks for sharing.
Lindsay, were you the one who put together the drive-bys when they had, for several times you had, for Halloween you had a drive-by, and you had a couple.
Yep,
Were you responsible for that?
Yes, ma'am.
Well, when this is over with, I sure would like you and Pat Biggers to get together.
Yeah.
Because she is from the auxiliary, and that way she can help you, and the auxiliary can also help you. Because you can't even do bingo anymore, can you?
Well, we've kind of squeaked along the gray edge of the okay. To get bingo still going, to keep flips still happening.
Kind of doorway bingo.
Yeah.
Okay. Because I know you used to, 4 seasons out of the year, there was always something that the auxiliary sponsored, and they would sell tickets and, raffle tickets, to keep their budget going, because they have always been a very big part of everything that has gone on out there with the residents. But it would be wonderful if you and Patty Bigger can get together after, on the phone, whatever, but discuss, because the auxiliary should be part of some of that too. And that way all of you can kind of get together on the same page again. How's that?
Perfect.
Because we're going to make it even, that way you don't have to do all the work yourself.
Angie, this is Patty. Let me just, first of all, Lindsay and I know each other
Oh, good.
prior to the virus impacting us.
Okay.
So, but for Patrick's benefit and the chairman's benefit, let me tell you a little bit about the auxiliary. You opened up the door.
Would
and,
you do that?
You know, I made a couple notes. So yes, we have in the past, and it was probably per head. I think our board treasurer is still looking for lists and confirmation and things. But in addition to $1,600 for gift bags and some personal items for the residents, we also, after the solicitation was put out there needing money, brought in another $2,000.
Yes, you did. And we spent it.
Do that. So it's not just, cut out window decorations, everything. We're talking about real money.
Oh, no, absolutely. Absolutely.
But some of the things we're really focused on resident support services. So in the past, and I have to talk about the past because, hey, things change with the virus. Okay, so paying for entertainment, special programs, bringing in individuals, the auxiliary. We have a gift shop with, general sundries, things that 50 cents, $1, whatever, but also a clothing shop through donations and also some purchases. We've put in there, and the clothing is free to residents. I can't even imagine what the last 10 months have been like, not being able to have that organized and such. I know my last day there was the 11th of March, and we were trying to get some St. Patrick's Day decorations up and change out, and then everything came to a stop. I'm afraid what that storage thing looks like downstairs with clothing. But anyways, but at Christmas times too, we donated Christmas cards. We sat with residents. We helped them with staff. We paid the postage to mail out their Christmas cards, sponsoring things like bake sales coming in.
You do birthday cakes too, right?
Well, we did a birthday gift for every resident on their birthday, a birthday card, a gift certificate to the gift shop for $5, a box of tissue, everything wrapped, delivered to them face to face. At Christmas time, we also did gift certificates. We opted not to because there's no gift shop. Right. And there's nothing more frustrating than getting a gift certificate and it's a defunct operation. So, but we'll be able to bring that back. We are short on volunteers. We spoke at our last board meeting way back into early 2020. And talking about kicking off and doing a membership drive for volunteers. Because as old as I am, I'm like the youngest chicken working. So physically, I'm like, they'll say, Patty, can you, yep, I can, but I've got to get some, people my age group and younger. So, but we can do that once we know a purpose. I wrote down here, who is the marketing firm that you're working with?
KMK.
KMK, great, okay. Because when you're talking about changing names and the auxiliary is a separate entity, has nothing to do with that. But that impacts our branding too. Mm-hmm. So we'll want to be kept in the loop as things move, and we develop our own little marketing materials and stuff to do. River Bluff has been multi-generational in my family, grandparents. My mother was there almost 7 years, and that's really what prompted me to get involved as a volunteer. Dan knew my mom, gave her plenty of hugs, but it's a jewel within the county. And I think it's important that county residents, county taxpayers understand what this means, not only to those that are there, but those that could be there. Okay, so I'm a big proponent of River Bluff, have for many, many years, and have tons of good things to say. So,
Well, thank you, Patty.
Well, and I will tell you, I think that's one of the other complaints you hear about is not having the gift shop. It allowed residents, especially on the dementia unit, a group of them will go down and they'd have their a little bit of money to spend, or again, it's normalization. You know, they're able to go down and, you know, pick something out to wear, or buy a card, or buy some candy, or buy a hat, or buy a statue, or whatever. And I remember seeing when there would be groups of them from the dementia unit, especially, you know, waiting at the door because they're going shopping. You know, it was an activity for them. So, you know, that's something that's been mentioned a lot. They miss having their gift shop back.
and as a volunteer, I'm looking, it's like if I'm registered now through the county to get my vaccine. So that's, I assume, is going to be another requirement for anybody coming in there, is you're going to have to show evidence of vaccination, still, you know, masking and such, but I'm raring to get in there and get that place available to them.
Yeah, for sure. It's going to depend on, right now, the only kind of, at this state, we have to get to a lower positivity rate in the county
Mhm.
before we could get to the point of letting any volunteers back in,
Sure.
unfortunately, because we need them. We need you guys. We need the families. I mean,
And
you
maybe
don't,
think about, Pat, too, with maintenance can let a couple in, start working on cleaning out that storage area, prepping things, even if it's 3 or 4 months away from actually being able to open up the services to the residents, but start getting that prep thing and
yeah, I think,
whatever
yeah,
has to be done.
yeah, definitely. We can look at that. Yeah, just to get ready for it again.
Okay. Thank you.
It sounds good. I'm glad we had this meeting today. Is there a possibility that within, from 2 months from today, that we can also host another meeting like this, whether we get together on a one-to-one basis or do it again on Zoom, to find out how we've come along with what we talked with today, get us updated, know that things are still going forward? Is that a possibility, Patrick?
Yes, for sure, Angie. We'll set it up for approximately 2 months out, and I'm glad we met today. This is the first meeting of the advisory board since I've been county administrator, so I enjoy working with Pat and her staff, and and Patty. It's good to meet you, and Lindsay and Dan. The whole staff there is just really pulling together under Pat's leadership, and I see nothing but good things going forward with the River Bluff facility.
Sounds good.
Yep.
Is our chairman still aboard?
Yeah, I want to echo what Pat Thompson just said. This was a wonderful opportunity for me to get introduced to the auxiliary and to the advisory committee. A lot of good discussion here today that I learned a lot of good things. And I'm here to facilitate any type of help I can be, working through Pat Thompson and Angie Gorel. So I'm here for you, and my office is open, my phone lines are open. So let's continue these good discussions and keep this jewel, as it was said, alive in our county. Thank you.
Sounds good. Thank you.
Dean was saying, sharing that.
Yep, thank you.
Anything else anyone wants to discuss?
Well, this is Sue. This is Sue, and we typically talk about staffing, and I'm just curious with the COVID, and you've talked about the number of staff that have had it. What is your how's your staffing looking? Are you guys surviving? Are you really struggling?
We are using so much agency now. And especially on holidays, they're hard to get. So this past set of holidays was rough. I mean, it was really, and we have a lot of managers out. So between our own people being out, using a lot of agency, they can choose not to work on the holiday. It's been rough. Up until then, we were doing okay. But that's the past month or so has been rough. But again, we're up to about 70% agency. For
How much?
CNAs. 70% for CNAs.
Holy mackerel. Do you want to tell our chairman, and Patrick probably knows already, how much that agency cost us?
We're just for our CNAs. Now this is a year's worth of data. We're paying $35.88 an hour as our average. And that was $2,668,904.
For CNAs alone,
Just for
agency,
CNAs. Yeah.
over
Yeah.
$2 million.
Yep.
That's one of the reasons why we're bringing forward the recommendation for increasing the CNA wage rate to hopefully reduce some of the cost of the contracted nursing.
People need to be aware of what it's costing us for agency. And with that money, we could be doing so much more just by paying our CNAs more money. And it just doesn't seem to click with anyone. That's one of the reasons that we've been in debt, is because we've been paying too much out for agency and not enough for people who are living in our area and or even our surrounding area. Because CNAs, nurses, if you really ask them where they come from, you're going to find they come from Winnebago County, Stevenson County, Ogle County, Boone County, and they also come from the state line for Beloit. And we have a lot of people that we could be supporting right now instead of agency. Because those agency people, how many of those are traveling people that come from way out of our area?
A good chunk.
Yeah, and that money should be staying within our area, because that's where they live and that's where they spend it, and it's foolish to be giving it to other people who are out of our area, and they bring the money back to wherever and not return it to us here in Winnebago County. This is really a big problem, and it truly needs to be looked into much further. Patrick, you've done a good job of starting with this. I know that's going to be a headache. Perhaps our new chief finance officer could help us with this, but we've got to get this staffing under control too. I know that's putting a lot on your shoulders. You have a lot of things to do, but truly we need to look into that deeper.
Well, we're bringing forward a resolution this week, Angie.
Thank you. You're the first one that's come out with doing it. And we've been talking about this for quite some time. This isn't new. This isn't something. That's why Sue hasn't seen any of us for 9 months, and yet she still remembers we had a terrible staff problem.
Yep. Well, we're trying to address it.
Okay.
Well, it's hard because I think a lot of the CNAs see working agency, they can make more money, they can set their own schedules, they can work when they work when they want. And for a lot of them at the age they are, the benefits are not a driving factor for them. So I know that we struggle with that too, that you can only pay so much, and you talk about your great benefits, but for a lot of the millennials, they're not looking at retirement or some of the other things that we have to offer that for many of us my age are very important in our lives.
Mhm.
Yes, and too bad we can't advertise for a, I don't know how you would say it, more mature person. That you know, that would really give us a lawsuit. But
We want the boomers.
I know, but that puts us right into a lawsuit situation. Maybe something on a bonus type of thing. I don't know. Because I know my daughter put in what was it, 190 hours in 2 weeks, because where she worked they couldn't get any staffing at all. They couldn't even get the other ones to come in. The
Agencies.
agents, yeah. And
When
this is a problem. It's a problem all over.
So
You
Pat,
have-
how are you doing for RNs and LPNs?
better than we are with CNAs, but they're getting a little rough too recently. They're getting a little bit rough.
And
But
is that because of COVID outages with your staff or
That's
vacant
part-
positions or?
yeah, that's part of the problem. I mean, COVID outed, okay. People being sick with COVID, being exposed to COVID. Just some of the staff have had to be off for medical leave for one reason or another. And again, they're not hitting the doors the way they were. You know, I mean, they're just not hitting the doors. You know, we practically have a party every time we hear a nurse or a CNA is, you know, coming in for an interview, you know, because they're just, you know, they're not there. You
Well, and
know,
there's not the job fairs right now because of COVID to go out and,
right.
you know, advertise or seek either, so.
And it makes it difficult, say, like Dan was talking about for the Dove unit, you have to have the same staff. You know, they have to know these residents. They have to know how to
Consistency is
take care of
key.
them.
Mhm.
Yeah, the consistency, and you don't have that with agency. And then the agency people tell our staff, you know, well, we make $18 an hour. And what ends up happening? We've lost quite a few of our own staff that have just said they're going elsewhere. They're going to agency.
I'm gonna still work at River Bluff, but I'm gonna do it through the agency and make more money.
Well, we've had a few of them try that. So we had a lot of few of them too, because we've been short. But
You know, you have to remember, for everyone that we bring in at $18 an hour, we're paying $35 an hour to the agency for that same person.
exactly.
And when you're looking at how much money we're paying, you know, it's absolutely ridiculous. We should be paying our girls the $18, and that way it's their money, not the agency's money. It just blows my mind. The whole thing blows my mind that we are locked in the way we are with our wages, and yet we can pay these wages to an agency. I just don't see any realization in it. In fact, we're messed up because we can't do what we should be doing. And again, we'll talk about that at a later time.
The agencies have just contributed to the shortage, you know?
Yeah, they have.
And they're popping up every day. You're getting more and more emails about this agency or that agency.
If we could pay that person the same thing that the agency is paying them, I wonder how many more people we would have that would love working with us. Because at that amount of giving them $18 an hour for agency, and the rest of it goes into, the other half goes into the agency's pocket. I don't know.
I think.
Yeah.
I know it'd be impossible, but I bet that you truly would have a line at the door.
And it's $18 with no benefits.
Yeah.
And you guys offer the benefits.
Mm-hmm. We have staff tell us they'd like to work here, you know, regulars from the agency, but we either have to buy them out, which is usually around $5,000 or $8,000, but they don't want to take the loss. They don't want to take the financial hit.
The pay cut.
Yep. So we'd be hit twice.
Well, one of these days we'll get that straightened out.
That would be nice. That makes,
Well, Sooner is better.
Yep.
But anyway, let's go ahead and, is there anything else we need to discuss? Any other questions? Can I have a motion to adjourn?
This is Sue. I would so move.
Okay, and we will then set this for next, the first Tuesday of March. I don't know when it falls on. I know I've got calendars here, but I don't have it handy. But let's try around the first Tuesday for March again and get us back on schedule, because we always did it on Tuesday, the first Tuesday of the month.
Be
Yeah,
March
that's
2,
March 2nd.
March
Is
2nd.
that what it is?
Yeah.
It's no holiday or anything like that. And let's try it for that and get together again, and maybe we can come up with some other ideas on doing this financing. So Happy New Year to you
We
all.
used to always meet at 4 o'clock. Are we moving the meeting time to 2 o'clock on the first Tuesday?
Is that more convenient for everyone?
Well, I've got a conflicting meeting that I'm gonna have to see if I can get them to rearrange if that's the time that we're gonna meet.
Is 4 o'clock better?
Sure, even 3 o'clock is better.
Why don't we do it 3 o'clock? That way we can get the people out before their day is over with, and that way they're getting paid to come to these meetings. Just as volunteers don't.
Sounds good. March
Awesome.
2nd at 3
O'clock?
3
Okay.
o'clock on the 2nd.
Yes.
Okay, well, thank you, everybody.
Thank you.
All of
Happy New
you.
Year.
Happy New Year. See you all in March.